Hello lovelies, and welcome to another Clean Smiles by Coco video. In today's video we are going to be talking about different drugs and medications that may be prescribed or available in a dental office. I wanted to make this video to maybe explain why you may have been prescribed a certain medication, why a doctor or dentist may be using this medication for your appointment, or if you know someone that may have had these different types of drugs and medications, why they may have gotten prescribed them. So stay tuned. The first drug that I wanted to talk about is Amoxicillin. It is an antibiotic and it's used to fight an infection. It is originally created in 1972 at the Beecham Research Laboratories, and it was created because there was a very narrow spectrum of antibiotics at the time, and they needed something that treated a lot more bacteria, and so they created amoxicillin from penicillin. They added an amine functional group to the penicillin strain, and they created amoxicillin. So if you ever hear a doctor ask you if you're allergic to penicillin and you answer yes or no, they're asking that because they want to know if amoxicillin would be a good option for you, because it is literally in the family of penicillin. The most common use for amoxicillin is if you already have an infection. It is used to subside your infection, and it's also used to prevent an infection. If you have an artificial joint, hip, knee, any type of surgery where you've replaced one of your joints, the surgeon will usually tell you or give you some type of medical clearance that says you are not to have any type of comprehensive dental work done without having an antibiotic in your system. And that's to make sure that you don't get an infection in your blood, because that leads to a lot of health problems that you do not want. I've seen amoxicillin in dental offices a lot. Sometimes they'll keep it on hand for patients that need to pre-medicate before their appointments. And I do see it prescribed a lot, and it's very common. The next medication that I want to talk about is Chlorhexidine oral rinse. It was originally created to be a disinfectant in 1954 in Manchester, United Kingdom, and it reduced the flora that's present on your skin, on your hands. It didn't make its way to the US until 1960, and it did not make its way into an oral rinse until 1976. During that time, they were able to just kind of play with the components of the oral rinse and just make sure that it was safe. It's described as a minty medicated type of flavor. It is not a Listerine or a Scope or anything like that. You can definitely tell that it's medicated, and it treats your soft tissue. So if you have any type of periodontal disease, any type of gingivitis, any areas in your mouth that may have canker sores, or that may be irritated if you got a popcorn kernel stuck in your gum, or a tortilla chip or something like that, sometimes the dentist may use a syringe and kind of flush the area out with chlorhexidine, and you'll notice in a couple of days that the area has healed back and it almost looks just like new. Jokingly, it's kind of called a magic rinse in the dental office. It reduces bacteria in the mouth. It's usually administered in the small cup, maybe 15 to 20 milliliters. The next drug that I want to talk about is Advil. The generic name for it is Ibuprofen. It was created in the 1960s in Nottingham by Dr. Stuart Adams with the help from John Nicholson and his team. Oddly enough, the actual brand Ibuprofen and drug Ibuprofen was created because Dr. Adams had a hangover and he had to deliver a speech, and he wanted a way to get rid of the hangover quickly. And he had already been doing research, already been kind of going through trials of different medications, and the amount of ibuprofen that he was able to take and not have any type of side effects and not have it do a substantial amount of damage to his organs. He was 600 milligrams and he was able to function normally and his headache was gone. The properties in ibuprofen are anti-inflammatory, and in comparison to Tylenol, it does not do as much damage to your liver. You're able to take it 200 milligrams, 400 milligrams, and feel a difference. In the dental office, I've seen it given to patients before they have their teeth whitened, just because your teeth are sensitive after they're whitened. So having the ibuprofen in your system already kind of working is going to help calm the nerves of your tooth down and make them not be so inflamed, because it is an anti-inflammatory drug. I've also seen ibuprofen be prescribed to patients after they've had a tooth taken out. There's a lot of pain in your mouth after you have a tooth taken out, and the ibuprofen works extra hard and overtime to make sure that it's helping to subside that pain. And I've seen it be prescribed in an 800 milligram pill, and the doctor will prescribe how many ever pills that they think is appropriate. The fourth and final medication that I'm going to be talking about today is lidocaine. Lidocaine is a numbing injection that is used in dental offices as well as in emergency room settings and hospital settings. It numbs the nerve from sending the signal to the body to indicate pain. That is what lidocaine does. In combination with epinephrine, it is able to stay in your system for as long as it's needed to for whatever procedure to be completed. Dentists typically use lidocaine on lower teeth because they need to numb a larger area in the mouth. If they're working on a very back tooth, they need it to be numb for a specific amount of time, and they need the nerves to absorb the numbing injection properly. So when they do the injection, they position it precisely so that it is able to be observed by the main nerve that runs from your jaw to the midline of your mouth. And so a lot of times when you get numb from lidocaine, the dentist will ask you if your lip feels fat, if your tongue feels weird, if it's tingly or anything like that, because all of those nerves supply pain or feeling to all of those parts of your mouth. Lidocaine was synthesized between 1943 and 1946 by Niles Forgren and Brent Lundquist. It was created because the anesthetic options at the time had toxicity concerns. They were only active for a short amount of time, and it took them a long time to actually get into the system. So it was just inconvenient for the things that the doctors at the time needed to do. It was actually first used in the emergency room to numb patients for procedures and surgery. Local anesthetic is when the doctor gives you an injection at the site that they're going to work on. General anesthetic is when you're put to sleep. So lidocaine is used as a local anesthetic in combination with epinephrine, like I said before, and it makes sure that they can get everything done that they need to get done without being interrupted or without you feeling it. We want the patient to be comfortable, and we want them to get all of the procedure done that they were scheduled for the day. Thank you so much for watching. I hope you enjoyed the video, and I hope it was informative. I chose these drugs because I had an interest in them. I wanted to understand them a little bit better, and I wanted to be able to explain to others a little bit about them. Don't forget to like, comment, share, and subscribe, and I'll see you in the next video. Bye.